Hello, the topic of today's lecture is professional ethics codes. The objectives that we have for today, first, to identify common themes of ethical codes spanning across AMPT, CAMPT, ACA, and so on. Second, to describe the limitations of the codes of ethics. And third, to describe 3 objectives that are fulfilled by codes of ethics. So one thing that you may be asking yourself as you look at the different ethics codes we'll use in this class is, why are there so many? And the answer to that really is because each one is a little bit different. They vary in the way that they're designed and in what they are attempting to achieve through their codes. Some of them are much more narrow in focus, which make enforcement easier. If you have less codes, then you can follow up on their enforcement a lot easier and really hone in on the things that you think are most important. Others are written in a more positive and aspirational way, so guiding clinicians toward what they see as ideal behavior. So they're going to be a bit more broad, a bit more focused on perhaps morals or values and overarching purposes like autonomy. And then others, of course, try to strike a balance between the two to give you a little bit of both and pull what they think are the most important things across multiple ethics codes. One thing to keep in mind, though, is even if you have 3, 4, 5 different ethics codes that you're referencing for your practice, none of them is going to be all-inclusive, and they're not going to offer guidelines for every single situation that you face as a clinician. You're going to face so many different situations that it's just impossible to have a code of ethics that addresses every single ethical dilemma. So it's helpful, of course, to be familiar with all of them. Some will cover information that others don't, but don't assume that everything or most of what you see is going to be clearly explained in an ethics code. Okay, levels of ethical practice. So ethics codes provide 2 different levels of ethical practice. The first are called mandatory ethics, and these are those that involve compliance with minimal standards. The focus on these ethical codes is behavioral rules, acknowledging the basic musts and must-nots. So very reminiscent of what we talked about when we went over laws and the prohibited and obligatory behaviors. So an example of a mandatory ethic that you might run into in the Code of Ethics has to do with informed consent. So the ethic codes will tell us that we must get informed consent in professional therapeutic relationships. And this makes it really clear, this is a behavioral rule, this is something that's expected, this is something that's mandatory as a clinician. So that would be an example. The second level of ethical practice is going to be aspirational ethics. And aspirational ethics are more codes that involve the higher standards of thinking and professional conduct, things that you can aspire towards as opposed to clear-cut rules. And so this is really pushing clinicians to move beyond just meeting the rules and doing crossing your T's and checking off your I's, but more so to focus on the spirit behind the ethical code. So knowing, for example, that autonomy is an aspirational ethic, what can we do to aspire towards encouraging autonomy in the therapy room? So things like doing collaborative goals or helping a client work through pros and cons of their decisions instead of making decisions for them. Those would be aspirational. There are also codes that are related to fees, for example, that encourage counselors to provide pro bono services. So this isn't mandatory, but it's encouraged because it's kind of the spirit behind it of doing good, wanting to be the most helpful we can be to our clients. So those would be some examples of mandatory and aspirational ethics. Okay, next we're going to shift gears slightly to talk about themes that are common across multiple different ethics codes. So again, AMPT, CAMPT, ACA, APA, so on. I'll be going over some of these, not in a lot of detail, by the way. I'm just going to really broadly touch on them because we're going to go into much more detail as we go through the different categories of codes in the coming weeks. Okay, so first off, responsibility to clients. So most of the ethical codes will have something to do with responsibility to clients. And this has to do with helping clients with the beneficence moral principle, if you remember that. So things like not discriminating against our clients, avoiding exploitative or dual relationships, getting informed consent, supporting autonomy, and not abandoning our clients, and so on. All of those things that you'll find across multiple codes fall under this responsibility to clients theme. Confidentiality, probably one of the first things you learn about therapy in your education, in your graduate education, is confidentiality. So there's definitely something about confidentiality in all of the codes. Things that fall under this would be like getting a signed release of information if you're going to breach confidentiality, disclosing risks of electronic media like telehealth, which is especially relevant nowadays, and how you go about navigating access to records, either by the client or by others. Confidentiality. Next, professional competence. This has to do with the standards of the profession. So making sure that you are doing what is expected of you as a clinician, such as seeking out training, expanding your scope of competence, which we'll get to in the next lecture, not engaging in any unprofessional conduct, such as coming to session intoxicated or something like that, and advertising your abilities and your education appropriately. Those would all be things that fall under standards of the profession for MFTs. Responsibility of the professions having to do with CAMPT. So this has to do very similar to the last one with really trying to uphold what it is to be an MFT. And one thing that I really like about this theme is that it really encourages us to get involved in public policy and to try to advocate for mental health services and the needs of our clients. Limitations. So just as the codes share common themes, they also share some important limitations that we need to keep in mind. First off, ethics codes offer unmistakably clear guidance for only a really small fraction of problems. They inform us, but ultimately they don't replace our critical thinking, our clinical judgment, and our knowledge of our clients. So they are not an end-all for ethical dilemmas, which you've heard me say multiple times. Ethics codes tend to be reactive rather than proactive, like what do you do in response to this problem, as opposed to what can you do to benefit your client from the get-go or to prevent the problem from happening. So that's a limitation that's important. They're much more reactive than proactive. Also, no two cases are exactly the same. So how you handle an ethical dilemma for one client may be drastically different from how you handle it for another client, and the ethics codes can't really take this into account. Then we have your values, which we went over in week 1. Your values may conflict with some of the ethical codes or standards. If you really value independence and assertiveness and autonomy, but you're working with a client who comes from a much more submissive culture where that assertiveness may be seen as a negative thing or an ostracizing thing, that can be problematic because it conflicts with what the client needs. And the codes might also conflict with state law or with culture or with the practices of your agency. And so those are also other things you need to keep in mind. With that in mind, we can use the codes as guides. So because of their limitations, ethical codes aren't really supposed to be used as like cookbooks where you follow step by step by step, but rather guides that can help us strive toward appropriate behavior. And they can also help us to see where our limitations are and what we can improve on. So there are, forgive me. There are 3 objectives that are listed here for how we can use the ethics codes as guides in our practice. So first off, the codes can educate us about sound ethical conduct, obviously. So reading and reflecting on the standards can help you to expand your awareness of what's expected of you and to clarify your values with regard to dealing with some of the challenges or ethical dilemmas you might face in your work. Second, they can provide a mechanism for professional accountability. So we are obliged not only to monitor our own behavior as clinicians, but also to encourage ethical conduct in our colleagues. And that goes into the standard of the profession theme that we talked about earlier. So this can help us to gauge when we need to make adjustments in our own practice or our own work, and also to help support our colleagues who may be struggling in certain areas and perhaps aren't aware or don't really know how to go about improving those areas. And then finally, codes of ethics can serve as catalysts for improving practice. So when you interpret and you apply the codes, the questions that come up for you in these ethical dilemmas help you to problem solve and to figure out what is your position on various different dilemmas, and to really see things from multiple perspectives instead of a one-sided or potentially biased approach. So we're going to look at a vignette here that is an interesting one in that it's one where ethical codes seem to kind of contradict. So remember when I was talking about limitations, I mentioned that sometimes codes, ethical codes can contradict or conflict, with your values or with certain state laws or culture or agency policies. They can also contradict with themselves sometimes, and that's what we're going to see here. So let's go through this vignette. Okay, I'm going to read it out to you. Whitney was referred to Carissa by her teacher due to a reduction in her school performance. Whitney is distraught and tearful during the first session and explains she's experiencing conflict in a romantic relationship. Whitney describes a series of misunderstandings in the relationship that have left her with hurt feelings. Carissa attempts to paraphrase Whitney's relationship trouble by stating, "It sounds as though you're questioning whether it's even worth it to keep trying to work things out with him." Whitney looks at her for a long while and then states, "It's not a him, it's a her." There's a long silence, and then Carissa changes the subject by informing Whitney that she will need to complete her intake assessment before they discuss the issue further. Following the session, Carissa meets with her supervisor, Sam, to process. Whitney acknowledges that she assumed her client's relationship had been a heterosexual one. She shares with Sam that she thinks it would be therapeutic for the client to explore her sexual orientation because, quote, "she's young and she could change." She goes on to state, quote, "I just don't know how to work with this client. I grew up in a very religious family, and it was ingrained in me that homosexuality is a sin." Okay, so in this particular case, we seem to have a bit of bias and some core values or core beliefs that are causing some problems here. Oh, sorry, forgive me, I thought I had another slide. So there's a couple of things that come up in this case in terms of the ethics. First off, there's autonomy and anti-discrimination, which are ethical codes. So we know from the ethical codes that we cannot refuse to treat someone based on their social group identity, such as in this case, sexual orientation, right? And then for autonomy, that would be the non-discrimination piece. And then for autonomy, we allow the client to work on what they want to work on in therapy instead of imposing. And so the potential here of Carissa's suggestion of exploring her sexual orientation because she can change could be seen as impinging on the client's autonomy in the therapy room. So put together, the autonomy and the anti-discrimination components would suggest that Carissa should put aside her personal beliefs and continue to treat the client even though her religious beliefs are a significant barrier. So Carissa needs to put aside her beliefs, her judgment, and her thoughts of what's best for the client to really focus on what Whitney needs or wants out of the therapy relationship. So that would be one angle. But then things get a little more complex if we consider scope of competence, which again, we'll get to in the next lecture. Scope of competence basically has to do with your knowledge about treating certain issues, right? And comes through training and education. So some would argue that being forced to provide treatment to a population that your religious beliefs preclude you from supporting would violate ethical clauses regarding competent treatment, right? Are Whitney's beliefs going to prevent her from competently treating this client? Okay, so Carissa's beliefs going to prevent her from treating this client. So if Carissa can't do these things, if she cannot put aside her religious beliefs and is not competent in treating this issue because of them, then it would make sense to refer Whitney out to someone else, right? So then here's the conflict. If she's planning on referring out, is that then considered discrimination because she's referring her out due to her sexual orientation? Right? And so you see how these things kind of are complex and confusing. So in this case, personally, what I think, the ethical codes and subsequent plan of action seem to require a bit more critical thinking, right? So what I think is helpful to remember here is that the ethical codes are designed to benefit the client. Okay, so if after she goes to supervision and maybe has some consultation with colleagues about this case, Carissa should then ask herself which course of action, refer out or continue to treat, is going to benefit the client most. Okay, and with that in mind, personally, I would say that if she can't treat Whitney in a non-judgmental, non-discriminatory fashion and support her autonomy rather than encouraging her to explore her sexual orientation to see if it changes, then it's unlikely that Whitney's going to benefit in therapy. And she may even be harmed if she hasn't already been, based on the judgmental comment that was made in therapy. So I think, given all of that, wanting to benefit the client, not being too sure that Carissa is going to put aside her beliefs, I think that Whitney should be referred out in this case. Okay. Note that this is also a situation where you could use the ethical decision-making model that we learned about a week or so ago to work through the case and see what you come up with. It's a complicated one, and it clearly shows that the ethical codes just aren't so black and white and don't really address everything that we're going to encounter. So there's an example for you. All right, thanks.